Good morning. I'm here today with the Deputy Chief Health Officer, Dr. Marianne Gale, and the Deputy Secretary of New South Wales Health, Susan Pearce, and also Deputy Commissioner Worboy from the New South Wales Police. To 8 p.m. last night, there were 830 cases in New South Wales. Sadly, very sadly, there were 3 more deaths. There was a gentleman in his 60s who died at Royal Prince Alfred Hospital. There was a gentleman in his 70s who died at St George Hospital. And there was a lady in her 80s who died at Wollongong Hospital. And to each of those people's families, I just want to express my condolences and sympathy to them. It's a very, very difficult time for them and for the broader community, but particularly for those families of those 3 people who passed away. To this point, in this current COVID outbreak, we have had 71 COVID-related deaths, and we currently have 550 patients in New South Wales hospitals. Almost 100 of those are in our intensive care units. And to 8 p.m. last night, the test numbers, which included some backlog cases, was 206,193. Dr. Gale will have a bit more to say about those tests. I am pleased, very pleased, that the vaccination rate in New South Wales is now quite extraordinary. And I want to thank the residents of New South Wales for coming out in such great numbers to be vaccinated. I'm advised that, in fact, New South Wales is now amongst the highest, if not the highest, in the world in terms of vaccination rates. And that only happens when the residents, the citizens of New South Wales, come forward to try and keep not only themselves, their families, but also the balance of our community in New South Wales safe, and indeed in our broader Australian community. I want to thank the New South Wales Health team, led by Susan Pearce, who had the foresight long before we had large amounts of vaccine to establish mass vaccination centres, because what we're now seeing is on any one day up to about 50,000 people are being vaccinated in our state hubs. Saturdays, of course, are a bit slower, but yesterday we still managed to achieve close to 45,000 in our state hubs. Last Saturday, so 7 days ago, that compared to 24,500. So that just shows the energy and interest from our community in coming forward to be vaccinated. That takes us to almost 58% of New South Wales residents have now had their first dose of a vaccine, and almost 31% have had 2 doses. And I want to thank all of those citizens for doing it, not only for themselves, but for their family and for their community and the broader New South Wales and Australian communities. In the last 7 days, it's quite incredible, but 750,000 doses of vaccine have actually been given out. That is just, if you'd asked me that a few weeks ago, I wouldn't have believed it as to how much we could possibly get out. So that's just incredible. Each week, the total number of citizens who are getting 1 dose is increasing by about 6%. And again, thank you to each of them who've come forward. I also want to thank, though, the residents who are in the 12 local government areas of concern. They have actually increased their vaccinations by nearly 8 to 9%. So the people who are in those areas that are very challenged are coming out and voting with their feet. They're getting vaccinated, and thank you to each and every one of you. That is such an important step forward. I'll ask Dr. Gale to say a little more about some of these issues and to expand on other areas. But I do want to stress to the community that there is obviously a broad-scale lockdown right across New South Wales. It's there for a reason. It's there to keep you and your family and all of the community safe. The answers are quite simply to this major dilemma that we have at the moment, and that is stay home unless you must go out for the essential reasons that we've become very familiar with, or go out to get vaccinated. Please go and get vaccinated. We want to drive our vaccination rates up more quickly. Even though we may well be the fastest in the world at the present time, New South Wales can still do better. And it gets us that much closer to coming back to what is a much more normal life. So I thank each of our residents who are doing that. I'll ask the Deputy Secretary, Susan Pearce, to address us in a moment about the opportunities for vaccinations, and she can give you a lot more information on where you can go to get those vaccinations. So first of all, Dr. Marianne Gale, who's our Deputy Chief Health Officer.
Thank you, Minister, and good morning, everybody. In the 24 hours till 8 p.m. last night, there were 830 locally acquired cases of COVID-19, and there were no overseas acquired cases. There were 206,193 tests reported, and as I'm sure you'll agree, that's a very large number. And part of the reason for that large number is, as the Minister said, there has been some backlog in recent days due to the very large numbers of people coming forward for testing, and so our teams have been working to catch up on that backlog of negative tests and getting that into the system. So that backlog has not affected any positive results. They have all come through through a separate mechanism, but part of what we're seeing in the big testing numbers today is a backlog of negative results reported through to the system, and we estimate that to be around a backlog of 60,000 that is now caught up, and so the actual real reflection of tests reported is around 140,000. So again, a big thank you to the people of New South Wales for coming forward in such big numbers to get tested. And I'd like to remind people as well, given some of the haze that we have at the current time, that if you are having respiratory symptoms, please still come forward to get tested, and don't just put that down to the haze at the present time. Even if you have the mildest of symptoms, please come forward. There are currently 557 cases admitted to hospital. 94 of those are in intensive care and 31 require ventilation. Of the 94 who are in ICU, 83 are not vaccinated, and the remainder have received one dose of vaccine. Sadly, New South Wales Health has been notified of 3 deaths till 8 p.m. last night, and they are a man in his 60s from southwestern Sydney who passed away at Royal Prince Alfred Hospital. He acquired his infection at Canterbury Hospital. He had received 1 dose of a COVID vaccine. The second sad death is a lady in her 80s from southwestern Sydney who died at Wollongong Hospital. She was not vaccinated and was a close contact of a case in the community. And the third person who sadly passed away was a man in his 70s from southeastern Sydney who died at St George Hospital, where unfortunately he had acquired his infection, and he had received 1 dose of COVID-19 vaccine, and his death is the second death linked to the outbreak at St George Hospital. On behalf of New South Wales Health, I extend my sincere and deepest sympathies to the families of those 3 people who have passed away. I'd like to draw your attention to the areas where we particularly want to see people being extra vigilant about coming forward for vaccination. And today I'd like to name the suburbs of Blacktown and the surrounding areas, Greenacre, Guildford, Marylands, Granville, and also Condell Park. In our regional areas, we are concerned about a positive sewage detected in Bateau Bay in the Central Coast, and I encourage all local residents to please come forward for testing. Also, residents of Lithgow, Parkes and Orange. In Western New South Wales, till 8 p.m. last night, there have been 36 new cases. The majority of cases continue to be in the area of Dubbo and surrounds, although we are also seeing cases in Bathurst, Wellington, Burke, Narromine, Goolagambone and also Orange. And our particular concern about Orange, and a call out to the people of Orange to come forward and get tested, is that while we have 2 reported till 8 p.m. last night, overnight we've had an additional 4 cases, making that a total of 6 in Orange at the current time. And so for all residents of Orange, please come forward to get tested. There are new testing options available at the Wade Park Sports Ground and also the Orange Showground. So please come forward to get tested. And for all residents of Western New South Wales, please maintain a high degree of vigilance for symptoms. Please come forward for testing. Please get vaccinated. In Far West, we had 2 cases till 8 p.m. last night, 1 in Wilcannia and 1 in Broken Hill. And again, for the residents of Far West, please come forward for testing. We remain concerned about the risk for anyone who's spent time in Wilcannia, so please come for testing. Finally, I'd like to say a big thank you to all the community for doing such a terrific job in complying with the public health orders, for getting tested, for getting vaccinated. And also a big thank you to the many organisations out there who continue to do such important work for our community and to keep our society going. And today I'd like to particularly mention the Australian Red Cross Blood Service, who do a terrific job in maintaining our blood supply, and all the wonderful donors in the community who regularly donate their blood. Obviously, maintaining an inventory of blood supplies during this time is challenging. And I'd like to remind people that leaving your home to donate blood is a reasonable excuse. And so if you are a blood donor, please get in touch with the Red Cross Blood Service and please keep those donations up. So thank you again to all the community for the wonderful job that you're doing. Please get tested, get vaccinated, and thank you very much again.
Thank you. I'd like to echo the words of the Minister and Dr Gale, and to thank the community for coming forward in droves to get vaccinated. It is so heartening to see those rates going up. We're so proud of the effort of the whole of New South Wales, so our GPs, our pharmacists and of course our state hubs. And that combination of those efforts is what's resulting in the numbers of vaccines that we're giving every day. I can't wait every morning to see what the last day's number was, and it is really a joyful thing to see those rates going up the way they are. This week ahead, we've got already over 200,000 bookings in our system, but we can do 200,000 more easily. Maybe not easily, but we can do 200,000 more. And the reality of it is we just really need people to continue to come out and get vaccinated. Do not delay. As the Minister said, it is reasonable to leave your home to get vaccinated. You do not need to be concerned about that. And those 16 to 39-year-old age groups in the 12 LGAs of concern, I urge you, please make a booking. Make a booking today. Do it for yourself, do it for your loved ones, and it is really wonderful, as I said, to see the communities in the southwest and Western Sydney responding the way that they have. We will continue, as the Minister said, to provide vaccinations on a variety of settings. We have very large centres set up, as you know. We have small centres set up as well, and everything in between. So no matter where you are, whether it's Wilcannia, whether it's Orange, Dubbo, Bathurst, or here in Sydney, there is a place for you to go. It may be a New South Wales health hub, it may be your local pharmacist, or it may be a GP, but everybody has the opportunity to get vaccinated. And with increasing supply of vaccine, that is one of the reasons why we set up very large centres to be able to deliver as many vaccines in a day as we possibly can. That is our goal here, and it is what's leading us to hopefully a brighter couple of months ahead. So once again, please, I'm urging the community, particularly of the southwest and Western Sydney, this is a great opportunity for you in those age groups in particular who haven't previously had an opportunity to be vaccinated because of the previous prioritisation arrangements. This is your chance. Please take it. For those disability and childcare workers who are required to have had a vaccine by the 30th of August, we will publish information for you tomorrow on newsouthwales.gov.au. We will be putting arrangements in place to assist those people to have priority to vaccination, and that will be available no later than Tuesday of this week for those bookings to be made. Thank you.
Thank you. Can I say a few things first? Good morning. Minister, Dr Gale, Deputy Sec Susan Pearce, 940 penalty infringement notices issued in the last 24 hours right across the state. Of course, many of those in the centre of Sydney and surrounds in relation to the protest or lack of protest activity, thankfully, in the city yesterday. What I would like to highlight today is, again, in the last 24 hours, is over 5,000 people right across the state were checked to make sure that they complied with their isolation orders. These are people that are directed to stay at home. These are positive cases. These are close contacts. These are people that clearly know that they need to isolate at a location. 5,000 of those people were checked in the last 24 hours by Australian Defence Force and police teams. One of those locations at Lake Macquarie, there were meant to be 4 people at that premise. There were only 3 who came forward and presented to police. One of those people were later found at an address at Kurri, which is some distance away. That person was directed to return back to her residence, which she did, and was issued a $5,000 penalty infringement notice. People need to understand that if you're under one of these orders or directions, that you need to stay put, that you need to do what is asked of you, because the actual presence of police in terms of inspecting that you are where you should be is not a routine thing. These inspections continue throughout the day and night, and in this instance where we have someone that clearly puts people at risk and goes outside of the agreement that has been reached, we will put that to the top of the list. Police will risk assess where they need to be, and that particular residence with those 4 people inside of it will now be checked on a more frequent basis to make sure that compliance is achieved. What I would also like to highlight today is that the emergency management arrangements at local, regional and state level are alive and functioning well in Western and far Western New South Wales. At Wilcannia at the moment, there's a local emergency operations centre open at the police station. There are the normal policing resources available to that community and are working hard with the community. The health resources are there. We actually also weave into that emergency management response there the support around other government agencies. It is a challenging and difficult situation, not just for the residents there, but for emergency service workers and functional areas. But people need to be reassured that not just the local arrangements, but how they feed that into arrangements at Broken Hill, the next biggest town, and then at Dubbo itself, under Assistant Commissioner McKechnie, there is a large and diverse group of people out of the RFS Academy there that plan and support those local operations, and of course that feeds into the CERCON here at St Leonard's. So people need to understand that these people are not and will not be left behind, that we will support them through what is a very challenging and difficult time, whether you live in a small remote community or whether you live in the centre of Sydney here. The arrangements work well, the same arrangements that we would use for a fire or a flood, but different in terms of the health and welfare of people. Thank you.
Done to disrupt that, and may I also ask, I believe there was a police officer that was injured yesterday. Could we have an update on his recovery?
Yeah, thank you. The police officer that was injured is thankfully, after treatment at the local hospital, is back with his family. He will make a full recovery, but again, it's just so disappointing that someone turns up to do their job to keep the community safe and suffers a head and neck injury that requires hospitalisation. That officer will be back at work quickly, which is again just an indication of that that determination for New South Wales Police to be a big part of the solution to the challenging times that we have. In terms of the demonstration or protest activity that may occur today, New South Wales Police every single day are scraping all of those social media sites. They have a number of avenues to get information and intelligence. Nothing surprises us about what these sorts of people might be planning. We are well in front of it. New South Wales Police Force will put together a policing response to whatever is required. And I guess if you look at yesterday, that was a very successful operation in terms of policing, but in terms of keeping the community safe.
Mr. While you're there, just the curfew coming into effect tomorrow, what are the police plans to enforce that, and also to what extent is it actually necessary?
So in terms of enforcing the curfew, I think it is one of those public health order arrangements that again is quite clear. There is no confusion around the 9 p.m. to 5 a.m. If you're out in that time, you must have one of those reasonable and agreed excuses to be out and about. So it's very cut and dry in terms of policing of those orders. What will it bring? It will certainly bring to the community a renewed enthusiasm about how serious this situation is. What we've found in some of those LGAs in southwest and western Sydney, that there is still a desire, an absoluteness around young people, young men wanting to leave their home and go about various engagements and activities through all hours of the night. And this curfew will signal this is the time that sort of behaviour has to stop. Police will be out, they will take action, and we just hope that everyone makes some sense of this and realises that we all have a part to play in this. We all have a part to play.
And tomorrow, of course, the outdoor mask wearing rule takes effect for the whole state. For those who are about to have that for the first time, who may be asking, can you wear a mask if you're outside walking for exercise? And if you're walking to the shops for exercise, can you have your mask off for that?
Yeah, in terms of exercising, people don't have to wear a mask, but where you are exercising in a place where there are crowds of people, or where you think you will end up in a situation where people will be close by, it is just common sense that you would put that mask on. You have to carry it. So if you feel that your safety, if you feel that people are too close, why wouldn't you put that mask on? So in terms of the second part of your question, sorry?
People walking to the shops as exercise.
Yeah, look, I just, I don't get this part of the argument. So when I go to the shop, when I go to buy a cup of coffee, when I get out of the car, I put my mask on, do my business and get back in the car. In terms of exercising to get a cup of coffee or to get something from the shop, there must be a point in time where you stop exercising and you actually then move amongst people or towards a shop, when I would suggest you put the mask on. I don't really think it is that hard, and I certainly don't think it's confusing.
The PM was talking this morning about vaccination rates.
Sorry, James, I missed that first part.
The PM this morning was talking about vaccination rates, particularly in vulnerable communities like Indigenous populations. Dr. Chan mentioned this the other day as well. They're lower than vaccination rates in Sydney, right? Mm-hmm. When Sydney gets to 80%, double dose vaccination rates, do you foresee a situation where Sydney opens up, but far west New South Wales and Indigenous communities are still locked down because their vaccination rates are so low?
Look, obviously the Aboriginal population of the country was in the group that the federal government agreed they would be vaccinating. But at this point, New South Wales Health is obviously doing everything we can to make sure that we support getting as many residents of Western New South Wales and far western New South Wales vaccinated. and many of those residents are Aboriginal people. I would hope that the arrangements that are now in place and are coming online in more numbers this week will see the vaccination rates escalate in the far west and western part of the state. I've been to places like Walgett and Wilcannia on quite a number of occasions, Brewarrina and so on, and the community size is relatively small. I mean, in Walgett it's probably about 3,500 people, but in the broader area maybe 6,000. And in Wilcannia smaller than that. So I think that we might achieve a reasonable vaccination rate there because of all the energy that the federal government is now bringing to bear to support the New South Wales government in relation to those vaccinations.
But Minister, the point is, or the question rather is, will Sydney open up when we get to 80% double dosed in Sydney, or do we need to get 80% coverage across the entire state for the whole state to open up? Can you open up Sydney but lock down regional New South Wales if the vaccination rate's there?
I think we're aiming to get 80%. The Doherty report looks at obviously trying to get the whole of the country in the order of 80%. So I think that's the aim of the game here, to get 80% of our community across the entire nation.
So
and
that
certainly
needs to happen 80% coverage across the whole state before we start getting some more freedoms in Sydney?
Well, let's work through that, James. I think you're jumping ahead, and that's okay. I admire your enthusiasm, but let's just work with that at the moment.
Minister, from here, we're seeing cases every 3 days or so skyrocket another 100, 200 up. When are we anticipating that we will hit 1,000, and at what point is the pressure on the hospital system going to become too much? What number of cases a day?
Look, we're well off that in the sense that the health system last year was stepped up quite dramatically. We quadrupled in New South Wales our ICU capacity in terms of ventilators. We have amazing health staff who are working very hard at the moment to keep us all safe, and it'll be additional pressure on them. They've already got additional pressure on them, and I'm quite confident that we will have adequate capacity as we go forward. Can I also just say this, that I think that not only are the staff doing it well, but I think that the cases at the moment are not jumping up in the sense of exponentially. They are up. They're up quite substantially in the last few days. But just in the last 2 days, of course, it's been in the 800s. I'm hoping that we will not see that major escalation. The other thing I think that we've got to remember, and I think most of the community would be well aware of this now, is that the symptoms can become, or the symptoms can manifest and become obvious any time in about 14 days from the first exposure. In fact, we've had cases where it's been even 16 days. So what we're looking at the moment, as we see these cases, is what occurred in terms of infections possibly up to 14 to 16 days ago. So it's going to take us another week or two off the back of the latest set of restrictions to really know what we're going to see. But we've been talking about that for nearly 20 months now, so I think most of the community will be aware of that. The short message, though, is we just need everybody to go back to basics, and the basics are this virus can only move from one person to another if you're in close proximity. And preferably stay outside if you can, although obviously in the areas of concern we're restricting people into their homes at the moment, so they can't go outside and share it with their neighbours and their community. Just stay at home and definitely go and get tested. So, hello.
There are, as we're about to see those 12 local government areas face harsher restrictions from tomorrow, there are some other local government areas, such as, say, Inner West or even Sydney, that seem to have more case numbers than some that are in these harsher lockdown areas. Why is that? And are we going to see some LGAs come out and maybe others go in over the coming
Look,
months? Everything's
on the table, but can I say, in regard to those LGAs, particularly the ones with the greatest number of cases, I did a quick calculation this morning, and it's about 80% of all of our cases overnight, or to 8 p.m. last night, actually came from those relevant LGAs. But obviously The public health team, the entire health team and the police are constantly working with us to try and look at what we might be able to do in regard to those areas that may come down to zero or have a consistent zero.
Minister, would you like to... you might have answered this before, but would you like to see schools go back early October?
Look, I think if you're asking whether I'd like it, yes, I'd like it, but is it going to happen? Well, that's a matter for the Education Department and Health to work through. I think we'd all love to see the kids get back at school, and the kids want to be back at school. But at the moment, the Education is in constant discussion with New South Wales Health, and I mean multiple times a day, to look at what options there are to get young people back to school in a safe way. At the moment, though, there's a lot of focus going on with regard to the HSC and how that might be done. I saw some reports in one of the papers today which I just want to stress wasn't entirely accurate. It was, I think the article was, but the headlines were not. And I just want to stress that there are continuing discussions between Education and New South Wales Health as to how we might be able to ensure there are public exams for the higher school certificate, but done in a way that keeps staff safe, keeps the examination supervisors safe, and of course keeps our very important young people safe. So that's an ongoing discussion at this point.
Are you confident that HSC can be done in a safe way, given that so many of the HSC students won't be vaccinated?
Look, as I said, the New South Wales Health Team, it's obviously an evolving situation, but there are many areas of the state where the risks are far less. And what we're obviously hoping is that if we can move forward in a really positive way, I mean, the people of South West and Western Sydney have just been incredible in the last few weeks in terms of coming up with the energy to get out and get vaccinated despite what's going on in that area. And I think if we can just keep those numbers up, then yeah, it's a possibility that we may be able to have the HSC students right across the state doing their public exams, but that's being worked through, as I said, between Education and Health.
Sorry, Minister, just to follow up on that, you said it's a possibility that kids across the state will be able to do their high school certificate, not a guarantee?
Oh, well, no. No, what I'm saying, I mean, there's no guarantees in anything here, James. You would know that by now. But that's what we believe they will be able to do. So the belief at the moment is they will be able to do it, and that's what we're working towards.
They have to do it, though, don't they?
Well, we're working towards that, yes.
But you can't give a guarantee.
Do you... Seriously, James, seriously. I'm saying to you, that's what we're working towards, and it's highly likely that it will occur. But both Health and Education are working through that. The expectation is that is what's going to occur. Yeah.
So it's understandable there's a focus on Year 12 and the HSC, but what about the other end, you know, the kindies to Year 2 who are, you know, needing to learn to read and write, the really fundamental basics? Yeah. Why isn't there the same focus on those kids who, some of them are going to miss 2 years of really important schooling?
Look, as somebody who's an ex-teacher, I appreciate that those first few years are the formative years, and I can only tell you, Alex, that New South Wales Health are working very, very much, very closely with New South Wales Education and the early childhood sector more broadly to see what we can do in regard to getting that back to more normal as soon as possible, but we're not there yet.
Do you think it can go back to normal though? Obviously without those children vaccinated, this is an issue with spreading among schools being shut down.
I'm quite confident that as we move forward to get to that 80%, we will have a lot more normality back in our lives, and it's literally only, well, it's weeks away now. So if our community keeps getting vaccinated the way they are at the moment, New South Wales is going to be looking pretty good by October, November. So I think I'm really encouraged by the positivity in the community in getting vaccinated. And I want to thank, by the way, the GPs, the pharmacists, the state health team, the nurses, the doctors, who are out there on the front line day after day vaccinating at rates that would have seemed quite impossible only literally weeks ago. So thank you to all of them, because through those vaccinations you're bringing us back to normality.
But isn't the point here that the children, and this is nobody's fault, cannot get vaccinated, so there are going to be a lot of parents who will feel very nervous about sending their kids to school as desperately as they want them to go back to school. Is there going to be a specific plan focused on children here as we start opening up?
Ash, I think I've answered that as best as I can, but if you like, we'll get Dr Gale to give some medical perspectives on that. Dr Gale?
Thank you, Minister. Clearly for New South Wales Health, our priority is the safety and the well-being of children and their families of all ages, whether that be young children in early childcare or those attempting to sit their HSC. As the Minister said, we're working very closely with education around what the planning could be, but it would be premature to sort of say what that's going to look like. Clearly those issues are very important and for Year 12s to sit their HSC, we absolutely understand that, but the well-being of students, of teachers and families is paramount. Our priority at the moment in health is absolutely about driving these case numbers down to get that R effective below 1 and particularly in those areas where we are seeing the bulk of cases arise in southwestern Sydney and Western Sydney. That's our immediate focus at the present time. While we absolutely need to keep our eye on that future target, our immediate priority is driving those case numbers down. And hence that's why we're really happy to see the population coming forward to get tested in the numbers that they are. And we await advice from ATAGI about the ability to vaccinate younger age groups. So we will absolutely be following that advice when that comes forward from ATAGI and looking at opportunities to do that. But for the community and to protect children, the best thing that we can all do at the moment is really focus our attempts on driving those numbers down right across the community. Getting vaccinated, and again it's just wonderful to see such high rates of vaccination through, so a big thank you to the community again and all the staff who are contributing to that effort. So that's really our absolute focus at the present time. Thank you.
Gale,
Thank you.
The text messages, sorry, Dr. Gale, the text messages that New South Wales Health is sending, right, to positive cases. What work has been done to send those text messages in multicultural communities with people who are positive that might not necessarily speak English? Has any work been done to communicate in their language?
Yeah, look, thank you for raising that. That's a great point. So at present, all the private laboratories are notifying by text people who are positive because we don't want any delays in people having access to that information so that they continue to isolate at home and that they advise their household contacts and anyone that they have been in close proximity with in the prior days to immediately self-isolate and get tested. So that's happening from all the labs, public and private. And equally, as soon as New South Wales Health becomes aware of those notifications from the lab, equally we SMS people with that information as well to continue to self-isolate, notify their household contacts, anyone who they've been in contact with. And so that's absolutely happening, and there is a phone number there that people can call. And interpreting services are available when people call that number. But, you know, clearly we're working through the issues to make sure that people across our society, whether they speak a language other than English or have lower levels of literacy, make sure that that information is understood and can be acted upon. So we're continually looking at those processes to make sure that all groups in the community get access to that information, understand it clearly and can act on it promptly.
Dr. Gale, with number of cases going over 800, what is that doing to health's ability to contact trace?
Yes, thank you. So clearly it's a challenge. The big numbers are a challenge. We want to see those numbers go down, but we're also realistic about how transmissible this Delta variant is and how much effort is taking across health, across our community, across industry, across police, our collective efforts to tackle the such great transmissibility of this Delta variant. And so while the numbers are up, and they're certainly higher than we would like them to be, there's a huge amount of effort going on to keep those numbers stable and drive them down. In terms of our contact tracing efforts, we have continued to surge the number of staff working to interview cases, follow up venues, follow up contacts, and that number of people is now over 1,000, and we're continuing to look at bringing more people on board, train more people, streamline our processes to make that process as efficient as possible. But it is a challenge, but there's a lot of people working extremely hard to keep those numbers stable and drive them down. So that's our absolute priority, and I just want to say a big thank you to all the teams working in health and all our partners across the state who are working so hard on that contact tracing effort to contact cases, support them, provide them with that information, support contacts, support venues, a huge effort, and a big thank you to everybody involved in that.
How long does it take one contact tracer to work on one positive case? If I've got COVID, how long does that contact tracer spend with me trying to find out where I've been?
Yes, thank you for that question. It can vary depending upon the complexity of individual circumstances. Sometimes an interview process could take around 30 to 45 minutes because we need to get information, basic demographic information from the person, find out whether they've worked in any high-risk settings, find out any high-risk venues that they might have been in. And then make sure that they are referred to all the appropriate services, so for their clinical follow-up, for any social welfare support that they might need. So that process can take anywhere from about 30 to 45 minutes, anywhere up to 2 hours and beyond. And clearly for some people who might have more complex life circumstances, such as mental health issues, or might speak a language other than English, or have other complex medical needs, then the team need to take a longer time to make sure that those individuals are properly supported.
Minister.
This morning the Prime Minister was really urging other states to stick to the vaccination targets for the reopening plan, which is based on the Doherty Institute. There are some premiers that are obviously concerned about opening up with such high cases in the community. Now, New South Wales has a lot of high cases. Where are we sitting on this? Are we just going to follow what the Prime Minister and the Doherty report, and then are you concerned that that'll put us at odds with other states?
Look, I think the challenge is that some states have relied on distance. So obviously, if you've got a long highway right across a desert, you can put a gate across effectively and say that's it, and think that that's how you manage COVID. Well, that's not probably going to be the long-term possibility. I think that Delta has shown itself to be capable of getting into every nation and every part of every nation across the world. So at some point that is going to occur. What I hope is that we'll be able to get the vaccination rates up in those jurisdictions in Australia that perhaps have not had the exposure to the virus to any great degree. But clearly that's more challenging because the communities, I think, could be and have been lulled into a false sense of security. Melbourne had a long, challenging, cold 4 months last year, which that meant, and has what we've seen off the back of that is Victorians have been very keen to get vaccinated. And New South Wales residents have had challenging times in recent weeks. And what we've seen here in New South Wales as a result of that, it's just normal human behaviour, is that when the danger's on your doorstep, you tend to want to get vaccinated. So I think we do have some challenging times ahead, but I'm pretty confident that we'll all get there as soon as possible. I'm hopeful that those other states that perhaps haven't had the bigger issues will manage to convince their residents that they all do need to get vaccinated. I mean, it's not hard to see the stats and see which states are not vaccinating at a particularly fast rate, and they're the ones who've had the least amount of challenges so far.
Minister, just on vaccination.
Sorry, I'll just go Ursula first, James, then you.
But on that, they're not going to open up to New South Wales if we have cases anywhere near where they currently are they?
Well, look, I think that that's something which they're going to have to think about as we move forward, because the aim here is to have a nation of Australia, one Australia. And I think that means that we have to, I mean, obviously New South Wales has tried very hard right throughout this pandemic. New South Wales has tried very hard not to close our borders. We've tried to stay open to the rest of the community. for the majority of the time, and I think that reflects the fact that the New South Wales government feels strongly that we are one nation, and we need to try and make sure that we stay one nation in a sense of it. We're a Commonwealth. Bring together 1901, we saw our communities from around the country come together as one Commonwealth. We are one Commonwealth, and I think that we have to move forward hoping that each of those jurisdictions will do what they can to encourage their citizenry to be vaccinated so we can actually achieve that opening for the whole
Just
of the
let
country.
viewers know that the ACT Chief Minister Andrew Barr has started his daily COVID update. For viewers in the ACT, you can watch that on ABC TV, and if you want to watch it on the news channel, we'll bring you that after the New South Wales update wraps up.
Yeah, well, we're working through those at the moment. The aged care workers, National Cabinet decided that it would be done by jurisdiction by jurisdiction. I think that's a little unfortunate because I would have preferred, as Health Minister in New South Wales, that the arrangements with regard to aged care workers and aged care generally was done through the Federal Biosecurity Act, because then there would have been a consistency across the country.
But the Premier agreed to do it by jurisdiction, so have you managed to...
James, can I finish, please? Please, let me finish. So what we're working through at the moment, we know that a couple of the jurisdictions have already put in place their orders. So we're trying to make sure that our orders are as consistent with each of those other states that have already moved on, and one territory, on the orders that are necessary. We've agreed to do it, but we've got to try and make it as consistent as possible with each of the other states and territories.
Running out of time though, aren't you, Minister?
No, we've got plenty of time to do that, and the community of the aged care know that they've got to get vaccinated by the date that's been specified, which is the middle of September.
Deputy Secretary, can I just ask, the uptake of the Pfizer for the 16 to 39 age bracket in those local areas of concern, it's been almost a week now. What have we seen in terms of the uptake now?
We've seen a really strong response, particularly initially, and I think people coming forward very quickly for that. So over 250,000 bookings from those 12 LGAs, which is wonderful to see. As I said, we've got capacity to do a lot more. We want to do a lot more. The vaccine is there, our staff are there, the hubs are there, so this is an opportunity. On Friday, we sent out over 1 million text messages via our colleagues at Service New South Wales to that community with the booking link embedded in it. We are talking to sporting clubs, community groups, everybody we can think of to encourage people to come out and get vaccinated. So there is no shortage of effort from our perspective in terms of everything we can think of to encourage people to take up this opportunity. All I can do is to please urge people to do that as soon as possible. There is no time for delay. There is no reason for delay. This is the chance and we want people to take it.
Minister, may I ask you, just to clarify something we were talking about before, this issue of hospitals, so from my observation, I think it looks like at this point New South Wales is just trying to keep the numbers as low as possible to not overwhelm the hospital system while we get the vaccinations done. Is there a point at which the community need to know that numbers are going to start overwhelming the hospitals, or are they already being overwhelmed?
No, we're nowhere near that. So as I said, we've got less than 100 people in ICU, and we quadrupled our ICU capacity last year from about 500 ventilators to 2,000. So we have, obviously there are people in ICU as well who aren't related to COVID, but no, I haven't had any advice at all at this stage sure that we're at that point of being concerned.
Sorry, hospital admissions sort of writ large. There's 500 in hospital today, not just in the ICU. You know, that's a big influx of people that need to be moved by paramedics. We're seeing ramping at hospitals. We're seeing paramedics doing hours on end outside of hospitals. Yeah. I think, but they're different issues. The hospital capacity is still substantial. In terms of those issues around ambulances having to wait outside, that's more about if there needs to be testing of patients in a different way these days because of the COVID pandemic. So what they're having to do is to test the patients to make sure when they're arriving whether or not they have exposure to COVID before they enter the EDs, unless obviously there are a range of reasons why ambulances arrive. And so
That does take a little bit of time to do in some cases when they have a substantial number of patients arriving. And I want to thank the staff again. The health staff in each of our hospitals are doing an incredible job in managing the patients. They're keeping them safe. And I certainly believe that all of our patients are being well cared for through paramedics and or our health staff in our emergency departments. Thank you. Sorry.
In the last few days, we've had major employers, a couple of the big banks, starting rapid antigen testing trials.
Yeah.
How close are we to seeing that more rolled out in hospitals for rapid testing of patients and other places from the state governments?
Well, rapid antigen testing is certainly a major opportunity for industry, but also the health sector. And in more remote areas particularly, rapid antigen testing can be really, really helpful. There is obviously the Health Ministry has bought a lot of rapid antigen tests. It currently has a contract out or tender out for a lot more. And in the next few weeks we'll be seeing a lot more come on board to support the PCR testing.
Sorry, just very quickly. Should the federal Parliament change the legislation which requires a rapid antigen test to be performed by a healthcare professional? Because overseas you can do it at home, right? But we've got legislation which prevents that happening here. Should that legislation be changed?
Look, I don't think that's a case for the Parliament. I think that's a case for the advice from the expert committees that advise the government. And at this point, that hasn't been considered. And I'm not sure that I don't believe it's absolutely necessary at this point. But it may be that as we move forward, the body that advises the federal government may well review that situation. But they have reviewed, as we're well aware, quite a few of their various advices along the way. So let's just take it again, James. I don't want to jump too far ahead. I want to thank everybody for your courtesy this morning, and thank you for getting the message out and importance of stay home. Do not go out unless you really have to, for one of the reasons that you know you can go out for. And please, if you haven't been vaccinated, make an appointment and get vaccinated. Thank you very much. Thank you.